Hi, Eric the Acupuncturist again. In this video I want to talk about how this lack of qi in terms of Chinese medicine, how that causes pain. And then I want to talk about how Western medicine views pain. So the ancient Chinese knew that every part of your body had to be reached by blood and this special thing that they called qi, which we know now is oxygen. So if the muscle becomes too tight, if it gets a, Western medicine calls it a trigger point, Chinese medicine calls it an sure point. Sure means, oh, that's it, because when it's pressed on, you can feel that that pain is reminiscent of the pain you've been experiencing. Now, why is it sore when you press on an sure point? Well, if the normal muscle fibers are loose and relaxed like this, then the blood, especially the oxygenated blood, it flows freely through those muscle fibers. Now, when the muscle locks up in a spasm, like happens in a trigger point, the blood cannot flow in and out of that spot, and that tissue becomes hypoxic. It lacks oxygen. When it lacks oxygen, it will start to send a pain signal to your brain. So Chinese medicine and Western medicine, they really view pain the same way. They just use slightly different terminology. The Chinese used pre-scientific terminology. We can use scientific terminology now. But regardless, they're talking about the same thing. It's a focal point of tension in the muscle that lacks oxygen, or qi as the Chinese would say. It lacks that, it starts to send a pain signal. So how do you treat that? Western medicine, for trigger point injection, they use a big fat old hypodermic needle and hit that spot. Okay. In acupuncture we use a much smaller needle to hit that spot. When you hit those fibers, they'll tend to twitch and relax. You can often feel the twitch. You might just feel it as a sore spot because this area that is lacking oxygen becomes hypersensitive. So you feel it when I press on it, and you feel it when it gets needled. Usually a dull ache, tight feeling, but oftentimes you'll get that twitch, and that's a signal that it's started to relax. Now your body responds to that micro injury of the needle by flooding that area with blood, and blood's the healer. That's what we want to happen. Blood will flood that area, bring oxygen, bring the nutrition it needs to heal that area, and take away the waste products and the damaged stuff out of that area. That's the basic idea of acupuncture and trigger point injection. Now on top of that, I give you a herb formula that has a very slight blood thinning effect. So when I get this loosened up, those herbs help drive the blood into that area to speed up the healing. Every patient gets that, unless they're on prescription blood thinners or they're pregnant women, then you'll skip it. You can still get better, but it's a little bit slower if you don't take the herbs. So that's why I have every patient take a special blend of Chinese herbs, help promote the blood circulation through that previously bound up tight area. Okay, thanks for watching.